Go.
Hi, my name is Nayeli. I am a student at STC. This is the video for Capstone. We're going to go ahead and perform the procedures of donning and doffing PPE. So the first thing we want to do is gather our equipment, and as you can see here, I gathered my hand hygiene, my gown, my mask, my face shield, and my gloves. So for donning PPE, the first thing we want to do is perform hand hygiene. Okay. After performing hand hygiene, we're going to go ahead and want to put on our gown. The gown is used to protect our uniform, to ensure that we don't get any bacteria on our uniforms or get any fluids on our uniforms or on ourselves. So I'm going to go ahead and tie it off in the front just to make it easier, as I prefer. As you can see, everything is nice and covered. My back is covered. So the next thing we're going to want to do is go ahead and put on the mask. And when you're putting on the mask, you want to make sure that you pinch the bridge of the nose to make sure that we have a nice seal. After putting on your mask, you're going to want to put on your face shield. And once you have your face shield on, you're going to go ahead and put on the gloves. And when applying your gloves, you want to make sure that you kind of tuck your gown in to make sure that everything is covered. Just like that. Okay, now we do one final check to make sure that I am covered, and then I would go ahead and perform the procedure and go into my patient's room. And now doffing PPE, the first thing we want to do, I'm going to go ahead and untie my gown since it's in the front. If it was in the back, I would remove my gloves prior to. Now that I've untied my gown, I'm going to go ahead and remove my gloves properly by pinching the front, rolling it into my hand, and squeezing in, making sure not to touch the outside. Now I'm going to go ahead and dispose it properly. Next thing I'm going to do is go ahead and remove my face shield and dispose of it. Now I'm going to go ahead and remove my mask, making sure not to touch anything on the outside, of course, because it's already infected. And removing my gown, so you want to kind of wiggle yourself out, making sure not to touch the outside of the gown. Pulling yourself out. When you're out of your gown, you want to make sure to roll the gown inward, making sure not to touch the outside of the gown, as so. And now you'll go ahead and dispose of the PPE. And you will go ahead and perform hand hygiene again. Okay, thank you.